Welcome to the Plant-Free MD podcast with Dr. Anthony Chaffee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. Hey guys, just want to take a second to thank our sponsor, the Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. But for those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25%. Hello, everyone. This is Dr. Anthony Chaffee here again with another podcast of the Plant-Free MD podcast, another episode, I should say. I have a very special guest, someone who I've known about for a long time, and I'm very excited to get on. Dr. Clemens from Hungary, who is in charge of, or a founder or in charge of Paleomedicina, which is a medical group and research group there. Dr. Clemens, thank you so much for coming on. It's a pleasure.
Thank you for having me. It's nice to be here.
Good. You're very welcome. I first came across an interview you did with Sean Baker, for almost 5 years ago now, back in 2018. And I was quite taken aback by it. You've been sort of in this arena of treating medical conditions largely with dietary measures and changes for quite some time now. I believe since 2013. Is that correct?
No, a little bit earlier.
Earlier.
A little bit earlier, yeah. That's, we call it 10 years into the diet field, and altogether it should be around 20 years in the medical field.
Very good. Well, can you tell us, for people who haven't come across you yet, can you tell us a little bit about yourself and your medical group and what you guys do?
Yes, sure. So I'm a biologist originally. I did my PhD at the Semmelweis University, Hungary, and I'm specialized in clinical neuroscience. And my special area include sleep, epilepsy, sleep EEG, neuropsychiatric conditions, so clinical neuroscience, so to say. So this is my original background, and as regards the diet, application of the diet and diet research, I've been into the field for the last 10 years. We do have a medical group consisting of physicians, and we call them dietary assistants, and we deal with patients with autoimmune disorders, cancers, epilepsy, diabetes, so anything that can be called as a chronic Western disease.
Yeah. So how did you come across this idea, which I fully agree with, which is that these chronic diseases aren't really diseases, but they're a result of things we're eating, and then reverse changing what you're eating can reverse many of these things. How did you come across that first, and how did you decide to take that into actual clinical practice?
So as I said in the beginning, I'm my primary background is epilepsy, and actually epilepsy is so far the only field in the standard side of medicine where the ketogenic diet or dietary interventions per se that involves low carb, high fat, something is accepted as an option, as a valid option. So I knew the ketogenic diet. I knew about ketosis, that it may be applied, that it may affect conditions beyond epilepsy too. I saw children on a ketogenic diet. So this was my primary background, and then I met with a physician in Hungary. His name is Csabatot, and he was the one who did this in a practice. That was a paleo diet, and at the time, about 10 years ago, we combined what we knew, his medical experience in my clinical experience with the ketogenic diet with children, and my research knowledge about vitamin D, because at that time I was also involved in vitamin D related research. So all this added up, and we founded a medical group, and then other physicians joined to the group. And since then we are doing patient job, we are dealing with patients, and we are also doing research work. We are publishing these results and things like this.
Very good. And so you said you treat essentially, anything that we call like, a chronic disease.
Yeah.
So, which makes sense. So basically anyone that comes to you with sort of an issue, you're happy to take in and put them on your protocol. Is there a specific protocol, or is there multiple protocols for different things?
Yes, it is a very specific protocol. So actually there is only one perfect diet, one therapeutic diet. There are no more.
I agree.
There are different opinions.
Yeah, definitely.
I'm glad to hear.
Yeah.
Because there are different opinions. You can hear that if you have a histamine issue, then you need a histamine intolerance diet, or if you are insulin resistant, then you need an insulin resistance diet. But actually, I believe that there is only one therapeutic diet, and you should apply this very strict, very fine-tuned diet if you come across any severe chronic conditions. And you can do allowances right at the beginning or later on, but this is the allowance part of the protocol. It may not add anything, it may not add any benefit. It is just more doable for some patients who do not have that strict conditions.
So, and what is your optimal diet?
So this is something that is a meat-fat based diet, and the fat part is very important. We call it PKD, which stands for Paleolithic Ketogenic Diet. We use this term because this was earlier than the carnivore was around. Yeah, I haven't heard about it. So, and we stick to using this term also because this is more specific in describing this therapeutic diet. And this is Paleolithic in a sense that it is containing only those food items that were available for the prehistoric man in ancestral times, which is actually meat and fat from big mammals. That's how it is. And we use a ketogenic part too, because this diet should ensure ketosis, ensure and maintain ketosis. So these are the two major components. Eat what you should eat, shouldn't eat, and be in ketosis. These are the two major components.
Yeah. Well, like I said, I mean, I completely agree with that only being one, optimal therapeutic diet, just because, I mean, it makes sense biologically. We are, I've made this point and previously, but we are one species, Homo sapiens sapiens, and so we're going to have one optimal diet. And I hear a lot of people say, well, it depends on your blood type, which is insane. Obviously, it's like, like one protein difference on your red blood cells isn't going to fundamentally change your entire digestive system. And it's not going to change your species either. Animals that eat
or metabolic processes are the same for everybody, no matter age, gender, nationality. It is the same for everybody.
That's it. And that's the thing. And I ask people, because the thing is that if two animals have entirely different optimal diets, not just what they choose to eat, but optimal diets, then they're going to be different species. Like that's just, I mean, find me one example where that's not the case. I don't think that anyone who's posed that to me, I've always asked them, I was like, okay, you show me one example anywhere in nature of two members of the same species that have different optimal diets. And no one's ever been able to come up with one. I've tried to think of one. I don't think any exist. So I definitely agree with you. And I think that the closer we get to that, whatever it is, I mean, you and I mean, I'm not saying that I think we're right, but it is something, it is something. There is something out there that is absolutely ideal for the human race. And I think that the evidence points to a PKD, carnivore diet, just meat and fat, and specifically, like you're saying, like a high fat diet. So I believe you're saying, if I remember correctly, it's a 2-to-1 fat to meat by weight. So that would be like 80% calories from fat. Is that correct?
No, the 2-to-1 is according to macronutrient ratio.
Right. Oh, okay. Calories.
No, not calories. Macronutrient ratio in grams. So protein to fat. That's the 2-to-1.
Right. Okay.
In energy, it is about 80-20.
Yeah.
But we like to speak about meat and fat because that's the practical way. You relate to food. If you go to a butcher, or you're not speaking of energy or anything, you say you need 100 grams of red meat and 20 grams of fat or whatever. Mm-hmm. So this translates to a ratio of about 100 grams of red meat, average red meat, that is combined with 35 grams of animal fat, pure fat. So this is the basic ratio to start with for everybody.
Okay, very good. And so when you put people on this, obviously you treat many different people, but what results have you seen, as compared to normal treatments?
What disease are you specifically interested in?
Well, we can go through the lot, but let's start with cancer, because in particular, I was quite interested in your original discussion with Dr. Baker and subsequent ones as well, because you've treated people with GBM and other primary brain tumors, and I've had very good results. And that's something that's of particular interest to me, being in neurosurgery, because it's a devastating disease that people almost invariably die from. It's considered a non-curable disease.
Exactly. Exactly. So it is very easy, because you just need to look at the statistics. So sticking to brain cancer, for example, we do have very good statistics. Because these statistics have been researched, published, everything, and you can look it up. And unfortunately, this is a progressive disease, which means that almost all cancer patients die in the end. It is just the time frame that can make a difference when it comes to low-grade cancer as compared to high-grade cancer. So the trajectory of the disease is always the same. And this is where the PKD may be a game changer, because we can put those patients into a stable state of the disease. So usually what we do see is that with brain cancer, there is a stable disease once they start following the diet properly, which means that there is no increase of the tumor thereafter. And this is already something, because, as I said, this is a progressive disease. This is expected to grow, because this is how tumors behave. This is just how it is. So if you can put somebody in a remission, progression-free state, that's already a big thing. And there are other benefits coming from the diet, like controlling epileptic seizures, because sooner or later brain cancers result in recurrent epileptic seizures, and then they need anti-epileptic medications to control this, which most of the case doesn't work, as we know. So then they also have the epileptic seizures to cope, and you can become epilepsy free on the PKD if performed properly. What we do see is that people start experiencing an improvement in their neurological deficits that they have because of the tumor, because of the space occupying nature of the tumor. So these improve if there is a fatigue which is very often the case with brain cancer. They improve their fatigue, they improve their sleep. So they can get back to living a full life, actually, despite having the same sized tumor in their head. They just have to be very careful with what they eat. There is not much space to play around, experimenting with this and that, because if they start doing this, then the tumor starts progressing again. So this is a lifelong diet therapy.
Yeah.
Of course, if a surgery is possible technically, then the surgery should be done, because it removes the problematic tissue, and then the patient gains a lot of time possibilities and everything. And what we also very often see is that, and this is in general about tumors, that if there is a tumor that is regarded inoperable in the beginning because of the heterogeneous shape of the tumor, this tumor may become operable in 6 months, for example, because the tumor gets demarcated from the surrounding tissue, and an operation may become possible due to the diet.
Yeah. And how many brain cancer GBM patients have you had over the years?
Oh, maybe 30, I would say, something like this, and maybe 100 brain cancer patients in total, I would say.
Yeah, and the ones that are able to stick to the PKD diet, very, very stringently, are they all getting the same results? Just maintaining their disease and not progressing?
In most of the cases, yes. But life is a real life.
Yeah.
And there are a lot of things that can happen. And if a patient is well controlled, coming back for a regular blood work control, MRI control, then if there is a mistake in the diet, for example, that shows up in the blood works, and then we have still time to correct it. So I would say, if we see that consecutive blood works also show that the patient is adherent, keeping low levels of inflammation, vitamin levels good, everything looks good in the blood work, then there would be no recurrence or progression of the disease. And there are other patients who do not come back with a ideal, optimal blood work showing that there was something not okay, either with their diet adherence, or there may be other hindering factors, or something that a patient is not even aware of, because this can be the case too. We not always know what we eat. We eat what we are given to eat. But if this shows up in the blood work, and if this is not corrected in time, then this may lead to progression. So we have the markers that would predict a recurrence or a progression. So a tumor progression is not out of the blue. There are always signs that come first.
Yeah. And well, I mean, even then, just being able to keep something stable that, if people don't know, like a GBM without treatment is on average 3-month life expectancy from time of diagnosis. And so, this is a very fast growing, very aggressive cancer. And so it's, being able to just halt that in its tracks is absolutely incredible, and will seem incredible to a lot of people who treat this disease, and hopefully in a positive way they go, oh, okay, let me think about this, maybe let's look into this, because it's something that absolutely deserves massive trials and studies to be done on them. I mean, this is a major killer. This is the most common primary brain tumor, and it is the most aggressive primary brain tumor. And so this is no joke. It's something that really, really deserves to be looked at. Have you published those results?
Yes, just one thing here.
Yeah.
that I think is related, that if you have such a devastating disease and deadly disease, then it is the best hardcore test of any therapeutic intervention, because otherwise the patient would die in 3 months or similar to that. But if you manage to prolong survival, that already says something. If you prolong survival from 3 months to 6 months, that is already 200% improvement in life expectancy, and this is something that chemotherapy drugs are not able to achieve.
Yeah.
Chemotherapy drugs, and this is also published. This is also statistics. On average, add a 3 months survival benefit over the no chemotherapy use, which is not meaningful when it comes to a patient.
Yeah. And have you published your results with your GBM and brain tumor patients?
The thing is that this case is published in a preprint form, and it was not accepted for publication in multiple journals. And in the end, I stopped trying to publish it.
Yeah.
But the case is still a case. It is available. It is as a preprint, and since the preprint has been done, the patient is still progression-free, alive, and lives a full life. This is around 6 years, if I remember properly, and with 6 years, 6 years progression-free survival of GBM.
Wow.
And this is a world record now for GBM with any therapeutic, basically with any therapeutic interventions, but within the diet field, this is the world record, because there are others that have been published, but there has been a progression in between, or died earlier than this patient.
Yeah. Well, also, yeah. So I was going to say as well, you obviously treat other cancers as well, I'm sure. And how do other cancers respond to PKD carnivore diet?
Yes, there are other ones that respond quickly, and reversal of the tumor can be seen too. These are the tumors that arise from tissues that have a quick turnaround time, like the intestine. So colorectal cancer reacts very well. We have oftentimes seen a disappearance of the tumor itself. We have seen that metastasis, or the activity, pathologic activity seen on a PET scan, disappears on the PKD. So the brain cancer is a difficult disease, because it is in a closed space, but other cancers are a little bit easier if somebody is properly following the diet.
Yeah, it's just funny too that the colorectal cancer, it responds so well because red meat is colorectal cancer is blamed on red meat. They say you're going to get colon cancer if you eat red meat, which is funny, which is obviously nonsense.
This is crazy.
Yeah, exactly. Yeah, and yeah, I mean, and those I mean, I don't even think you can call them studies. I mean, they were just they're taking pieces of epidemiological mismatched statistics and sort of cherry picking data and deciding what to put in, and with massive amounts of confounding factors, and it's been reproduced and corrected for those confounders, and absolutely no association between red meat and colon cancer, and yet people still cling to this. I hear colorectal surgeons in the hospital still telling their patients, oh, and watch out for red meat, that'll cause colon cancer. It's like, no, Jesus, no. Yeah.
Yes, that is very sad.
It is. Yeah.
And you cannot do about this much, because you cannot go against the whole system, the whole pharmaceuticals, and so what you and I are representing goes against what everybody else is representing, and what is in the interest of everybody else.
Yeah. Which is interesting to me because, I mean, I can understand, different, interests. Like, I spoke with Professor Thomas Seyfried at Boston College, who does a lot of research into cancer and specifically GBMs in animal models. And he was just saying, it's a shame that we don't have money backing this. There's nothing to sell when you tell people just don't eat carbs and sugar. And, so we have to sort of think of something that would make it economically feasible to profit off of this. And then there'll be some money behind it to back it, to push these human trials. Obviously, there is money when you're investing in a pharmaceutical, because you can then sell that pharmaceutical. That makes sense. But just in that vein of just sheer financial interests, why is it that public government healthcare systems, which much of the world has, why I don't understand why they wouldn't be interested in it? Because it would save them so much money. They wouldn't be paying for expensive surgeries, expensive chemo, expensive radiation, millions of dollars on a CyberKnife machine. And, these things are very, very expensive, and they're expensive to treat. And so, I would just imagine that they should be all over this, but they just aren't, which is crazy to me. They could just save millions, like billions, really.
Yes.
Yeah. Yeah. And
maybe it's controlled by somebody else. I do not want to get into because this is too much politics.
Well, it could be too, but that's the thing too, that it is surprising, that it would save healthcare systems a ton of money. And just get on this thing and say, hey guys, just don't eat carbs. Just get on this metabolic therapy, and you'll be set. So you were talking about epilepsy as well. That's your background. Can you tell us a bit about just the history and the science, and what we know about how epilepsy responds to diet?
Yeah, so there is a 100-year history behind the research between epilepsy and the ketogenic diet. Actually, the ketogenic diet had a 100 years anniversary, I think last year. Nice. But everybody forgot about it because it was the COVID everybody was speaking about. So, anyway, so yes, there is 100 years of research and experience behind something. That should already mean something, because if we are speaking about the novel drugs, anti-epileptic drugs, there is only a few years, sometimes experimental medicines, which is not comparable to 100 years of research behind something. So, and there is also research data, statistics, everything. So this is way more than just anecdotal data, as many people believe. It is just a few cases, anecdotes. No, this is not the case. There have been huge studies done in the US in the 20s, 30s, 40s, when the ketogenic diet was the only and the only available therapy for epilepsy, and there has been nothing else. So if you had epilepsy, if you had seizures, you were put on a ketogenic diet, and there was no other option. and this was until I guess until the 30s, when the first anti-epileptic drug was released. This was called the phenytoin, and children were just put on phenytoin. And since then, it turned out that the phenytoin is one of the most detrimental anti-epileptic drugs. It is effective to some extent, but very detrimental to your brain health. And it is not used anymore in the clinical routine because there are so many side effects. This turned out in 80 years. We do not really know the side effects, the full side effect spectrum of the modern anti-epileptics as compared to the phenytoin. So there has been a massive use in the US. There are research. The research data show that it is, at that time, it was 50% of the epilepsy patients who became completely seizure-free on the ketogenic diet. on the type of ketogenic diet they used at that time in those hospitals, because there are variations. This might not apply for modern ketogenic diets. But I think this is massive. 50% seizure freedom is way more than what is achieved with anti-epileptics, which are typically used in combinations if one is not effective.
Yeah. And it's also better for you in many other ways as well. You're getting other health benefits apart from just the control of your seizures, and it doesn't give you these massive amounts of side effects that, you know, can make you feel pretty horrible.
Yes, so including bad sleep, behavioral alterations in children, hyperactivity, or developmental delay, or all kind of things emerge from anti-epileptics and not well-controlled epilepsy itself.
Yeah. It is very sad. Is a ketogenic diet still used to treat epilepsy in Hungary, or not as much anymore?
Not as much. It is only used as a last resource, and only in children, not in adults.
Yeah, it's annoying.
Yes, because it's much easier to prescribe medication, and you release a patient, and the patient will come back in 3 months, and that's it.
Yeah.
But if you start treating somebody with a diet, that is much more work on both sides.
Yeah.
And that's not sustainable in the current medical system.
And I think we've just gotten pretty lazy on both ends, because people just want a quick fix. They say, "Oh, I go to the doctor gives me something, everything's better." But also doctors is just like, well, like you say, I don't have time to coach this person and spend an hour discussing it, and then bring them back weekly for check-ins to make sure that they're being compliant. And it's not
maybe
that
once a week is not enough. Actually,
yeah.
What we do is a day-by-day feedback in our program across 2 weeks, and this is something that is working. Nothing less than this can work in our experience. So that's why we use this time frame.
Yeah, no, that's true. And the thing is too, that a lot of doctors I've spoken to have said, because this is certainly in the literature, and I've even seen the other top institutions around the world still use this. I saw a paper, it was an older paper from Johns Hopkins discussing a ketogenic diet for epilepsy, and said, well, this is really sort of falling out of favor in favor of pharmacological treatments. But this is something that still works, and we still use it, and here are our results, and which was great to see. I don't know if they're still doing this. It was an older paper, but it's at least hopeful. And a lot of people will say, well, it's very difficult.
But they should upgrade it a little bit.
Yeah, probably. Yeah, definitely. Yeah, and
this is something I do not see happening with these big institutions, because they still stick to the version that they used in the 90s. And since then, it turned out that cholesterol is not harmful, eating organ meat is not harmful. You should eat animal fat instead of vegetable oils, and I do not see these components being involved. So they still stick to the version they used before.
Yeah, that's very true. And then some don't use it at all. They say that it's too difficult to get people to stop eating carbs. And I was asking them, I was like, well, have you tried? Like, well, no, you just in general, it's hard. I was just like, okay, well, you haven't tried. You should at least try and exhaust that avenue before you just start, pumping people full of drugs.
Or at least inform a patient that they have a second choice.
Exactly.
And then it is up to the patient what he or she wants.
Yeah.
But at least he should be given the choice to choose what they want.
Yeah, and that's the thing too. I've had that discussion with many patients at this point, and I don't think I've ever met one person that wasn't very interested in that. One lady, her daughter was was unwell. I was at the pediatric children's hospital, covering an on-call shift, and there's a little girl that was very unwell in the middle of the night. We didn't know what was going on. We rushed her down for a CT, and I just sort of I was just checking her. I was just like, something's wrong, and I just checked her, and her eyes were like dilated and fixed. It were abnormal movements. I'm like, okay, she's seizing. That's what's going on here. And she was just having these subtle seizures that wasn't the big tonic-clonic in nature, but there were certainly seizures then that explained a lot of what was going on. And so we were able to treat her and get her well. And I was speaking to her mother after that, and just sort of mentioned, it's like, hey, by the way, there's a data going back 100 years in pediatric epilepsy that you just get them on a ketogenic diet, just stop eating carbs, and this can significantly help. She just went, oh, really? Wow, okay, yeah, we'll do that, just like that. No effort. It wasn't nothing. I didn't have to try to convince her at all. She was all over it. Especially parents with their kids, they're going to be very scared, very worried. And if a doctor says, hey, by the way, there's this easy remedy that you can do. Well, it's simple anyway. It may not be easy to, pry the cookies out of a kid's hand, but it is simple. It is straightforward, and it can be done. And so, especially when, like you say, when someone is very unwell, that's really the time to do something. That's the real testament of a diet. If it's going to improve you in serious extremis, then that is very good evidence that this is a very positive diet.
Yes.
Yeah.
Even if it is only 10% of the patients who are willing to hear about it, and maybe it is only 5% who really want to do the job on their part, because I guess it may not be more, then at least this 5% of the patients are helped and improved their life. Yeah,
definitely. And how do people come to you? Does your clinic recruit? Do you have is it just word of mouth that people are unwell and they find your clinic themselves, or how do you get out there that
we do not recruit? We do not use any recruiting technique specifically. It is just the patients who are looking for a remedy find us in some ways. The very typical scenario is that patients start using a ketogenic diet, but they do not see the results, what they want to see, and they do further research and they find a carnivore diet, and they are getting better, but still not perfect, and then do their research further, and then they may end up finding us, and then they are put on a PKD, and usually this helps most of the problems that was not that improved on a ketogenic diet or a low carb diet, but was not fully resolved on an undefined carnivore diet, because carnivore is a general term. A lot of people understand very different things, and all in all, it is very undefined. And if you are coming from a chronic disease situation, you need very specific advice and very specific meat-fat ratios and advice what to do with a medication, whether supplementation is needed or not, or how to control the disease and so on. So carnivore is good for doing your own and then see the results. But a medical profession is a profession because you know more than a layman who is just experimenting with something picked up from the internet. If you have a disease, you really need somebody who had many patients with such a disease over the past few years. Otherwise, there is no data, there is no studies you can rely on. You can only rely on your own experience with the same disease. Yeah. And actually, this is what we have, because otherwise, how do you know what to say to a type 1 diabetic to achieve perfect results? because this is also a very quickly progressive disease in the beginning, and the same can be said for cancer. So you have to be very specific.
Yeah, absolutely.
Otherwise, the patient loses time, important time.
Yeah, yeah. And you're talking about neurodegenerative diseases as well. So what sort of neurodegenerative diseases would you treat at your clinic?
Multiple sclerosis, for example, Alzheimer disease, Parkinson's, but multiple sclerosis is maybe it is the most frequently seen disease.
Yeah.
And, there are benefits. It is just something that takes a long time, much longer as compared to Crohn's disease. Because any disease that emerges from the gut, where your tissue are regenerating themselves very quickly, anything that is arising from the brain is more difficult to deal with. But we have seen improvements, neurological improvements too, with multiple sclerosis, so gaining back movement, but at least 6 months of strict diet adherence is needed.
Yeah.
So, for example, we have seen a lady who was sitting in a wheelchair for something like 20 years, and after 6 months on the PKD, she was able to stand up just by herself from the wheelchair. So this is a neurological improvement.
Yeah, definitely. And it's the thing, it must seem like faith healing to people who are seeing this. I mean, like someone's in a wheelchair and it's just like, oh, Jesus, or I was just get up out of the chair. And that's how it must seem to people, because they don't think like that's not possible. That doesn't happen. People don't, have such a neurological deficit and then come out of a wheelchair, but it does. And I've seen it as well. I haven't seen as many people as you have, certainly, with MS, but or in general, probably, with this sort of thing. But I've absolutely seen people improve dramatically with MS, and autoimmune issues in general respond very, very well, I've found, to a carnivore diet or PKD diet as well. And as far as Alzheimer's, what have you been seeing with that? Because that's obviously very devastating to people, to lose their faculties and really their humanity and who they were as a person their whole life.
With Alzheimer's, it is a difficult situation because it usually requires somebody from the family acting instead of the patient. So it is not very often seen that a patient with Alzheimer's comes himself to us asking for help, because they were not able to do this. But if there is a family member that is controlling everything around that patient, then at least a stabilization can be achieved, and improvement in mental clarity can be improved.
Yeah. How long?
But this is a big job. This is a big burden on a family, and not everybody is capable to do this.
Yeah. How long does it take normally before you start seeing improvements in cognition in these patients?
In Alzheimer's, so the mental, it is depending on where the patient is coming from. If the patient is coming from eating a Western type diet, then you already see big improvements in the beginning, like improvement in sleep, brain fog improving, in improvement in verbal skills, the speed of the speech. These are all improving.
Yeah. And then obviously, there's only probably a certain limit on what that can regrow.
Yes.
I mean, I think there's probably damage done at a certain point as well.
Yes. If I remember properly, I do not remember any full recovery with Alzheimer's.
Yeah. I wouldn't imagine. Yeah. But even getting,
who knows, if because nobody's 100% perfect.
No, of course. Yeah.
Specifically an Alzheimer's disease patient, definitely not the best candidate for achieving best diet control, because this lies in the hand of somebody else who cannot control an adult elderly person in his or her own life. So it is in reality, this is something like fluctuating. So
Yeah.
A daughter of Alzheimer's disease patient, she's coming back to me quite regularly, and she herself says that we are very good with the diet, but it is fluctuating. The blood work shows that it is fluctuating. If there are fruits in the garden, she will be eating the fruit.
Yeah.
And then she is out of ketosis for a few days and back into ketosis, and the whole process starts again.
Right.
But she realized that, or it was actually the sister of this daughter who told her that on the days when our mother is in ketosis, she has a better mental clarity as compared. Her look is better. The way how she looks at me is very different from when she's not in ketosis.
Yeah.
And so this is fluctuating, but takes off some burden of the family, even if there is not a full recovery.
And is also, yeah, I mean, and even just that is an absolutely phenomenal benefit, and just not getting worse is also a fantastic benefit, and getting whatever improvement, I think is incredible.
Yes, and this also enables tapering down the medications that elderly people usually take.
Yeah, which is also really nice. You're not getting all the side effects of those.
Yes.
Yeah, and Parkinson's as well. Have you seen good results with that?
We have seen improvement, but not I have to say, not a full recovery. Parkinson's can be maybe associated with a myriad of symptoms, both cognitive symptoms, motor symptoms, sensory, and many of them are improving. Yeah,
very good. Yeah, my father was diagnosed with Parkinson's several years ago, and thankfully I came across, I sort of rediscovered this because I'd been doing it, 22 years ago, just because I stopped eating plants because I took cancer biology and botany and just learned how toxic plants were, and that I didn't want them in my body, and then sort of rediscovered that about 5 years ago or so, and my father ended up adopting it as well, just because I was having such good results, and I was just digging into the literature, trying to find out what we knew, what we could prove, and what we could show based on the evidence that was already published. And I was very excited about all the things I was finding out. And so he became interested in that, and he and my mother tried it, and he had a massive improvement, absolutely massive improvement, life-changing improvement. And he was didn't have very, very pronounced and profound Parkinson symptoms. They were still pretty subtle, but his memory was very affected. His energy level was very affected, and he didn't have the energy to do much more than get out of bed and go and sit on the couch and watch television. And even then, you just see him, he was just wiped out. And within a month, he was just literally had like a spring in his step, was bouncing around, was speaking more. Before he would speak very quietly. You couldn't even hear him unless you were sitting right next to him, and he would barely ever speak. There would actually be days that I wouldn't hear him speak, and I was staying with my parents at the time and helping them through some health issues. I wouldn't hear him say a word for days at a time, and then all of a sudden he's just his old self again. He's speaking, bouncing around, everything like that, and it was just amazing. It was absolutely incredible turnaround.
Yes, that's amazing.
Yeah. And
to see the reversal of the perceived trajectory, because you think that this is how elderly people should live with the disease. This is inevitable, but then you may realize that this is reversible, at least to some extent. Yeah,
and that people can still live full, healthy lives, even in advanced age. My father's 82, but he's I don't know, 20 times better than he was when he was 78. Because he's just, he's just, he's improved so much, and hopefully will continue to improve. He's still, he's still not how he was when he was 60, but he's a lot better. And my mom is doing incredible as well. And so it's just really nice to see. I mean, I really like, getting this information out to people, and like you say, just at least getting it out to them and let them make the decision. And it's very, very, very heartwarming to see people that have taken that advice on and really changed their life and benefited from that. I really like that. But it's, obviously especially nice when you get to do that for a loved one and they improve so much, and you get to have more of them, and more of them in good health. And so I've been really, really fortunate in that as well. You must have, 1,000 stories like that where you've had people make miraculous recoveries as well.
Sure. Yes.
Yeah. Yeah. And what about like you mentioned Crohn's disease, and that how the disease, things in the gut would heal well, obviously because there's a high turnover rate. That makes perfect sense. And I've certainly seen that, Crohn's and ulcerative colitis respond very well. And everyone that I've seen go on a pure carnivore diet, especially like a pure red meat and water diet, they for Crohn's and ulcerative colitis, they've had basically near full resolution of their symptoms within a few weeks. And then on biopsy of their intestine, they have no sign of disease within 3 months. I've never seen one that had a positive biopsy after 3 months. And so it's pretty incredible. What are you seeing similar things with your Crohn's and ulcerative colitis patients?
Yes, they're very similar.
Yeah.
It is. So the Crohn's disease is fully reversible in most of the patients.
Yeah. Yeah. And what about rheumatoid arthritis? This is something that we've seen, like even in the literature going back to the 1800s, as responding very well to a red meat and water diet. Do you have rheumatoid arthritis patients as well?
Yes, many.
Yeah.
Yeah, they reverse their disease too. Yeah.
Yeah, which is amazing.
It is. Yeah.
Such a nasty thing too. I mean, it's just eating away at your joints, and it's horribly painful, and makes permanent destruction. I would imagine that they wouldn't be able to correct the deformities and regrow bone and cartilage, but at least it would just stop any further progression. And that's something.
And it is appearing in younger and younger ages. So, maybe 20 years ago, it was the disease of the elderly.
Yeah.
Rheumatoid arthritis, but now the juvenile rheumatoid arthritis is something that is very explosive. Maybe the youngest child I've seen was 3 years old and already had rheumatoid arthritis, which is almost crazy. Incredible. Yeah. Crazy, yes. And these small children undergo very invasive therapies like biological therapies. That is not helping their disease. No. It is just setting up for more side effects, lasting side effects without, fluctuate. This is resulting in something like a fluctuating disease coming back, but not resulting in a resolution of the symptoms. Mm-hmm. It is a lifelong condition starting in early childhood, which is terrible. Yeah. Now, when it is actually reversible with another very simple method that nobody believes because it's too simple to believe. Yeah,
well, that's the thing. Yeah, and imagine putting a 3-year-old on methotrexate.
Yes,
that's insane. And
exactly.
and you in traditional thinking, you probably would have to, like, well, what's the alternative? Yes. Their joints just decay and break down, and that's that's worse than getting just.
Yes, that's what the protocol says. And in a real hospital setting, if you're a physician, you cannot really go against the protocol.
Yeah, and I mean, and that's another thing. these are very expensive treatments as well. The DMARDs and the biologicals and all the other medications that you
Extremely
receive.
more and more expensive. So
Yeah.
I guess this is one of the answers to your question.
Mm,
Why not doing a diet therapy instead of a biological therapy? I think this is a number one thing.
yeah, unfortunately, it probably is, and having those influences in our influencing the people that make these decisions, unfortunately, is probably exactly where that's coming from, unfortunately. But I suppose that's why we do these sorts of things, and people like yourself and myself strike out and just try to treat people the way that we know that they can be treated, and get results, and try to get the word out there, and try to have people see these things and say, hey, by the way, you don't have to spend $6,000 a month on these pills that make you feel horrible and sick and stunt your growth and intellectual development. You can just stop eating plants and go back to a meat-based diet and thrive. Now, forget rheumatoid arthritis, you'll have 1,000 other benefits that you never even realized were possible.
Yes.
Yeah. Okay.
Anthony, are you able to do this in a hospital setting?
I do it anyway.
Anyway.
Um, I'm not, people ask me, it just comes up sort of naturally, because it's very obvious what I eat, and so it'll sort of come up. People ask me about it, and I'm in good shape, and so people will say like, "Oh, you only eat meat? Well, what about vegetables and all these sorts of things?" So you get the same questions, and you talk about it, and I'm working with people that, I've I've only come across a few doctors that aren't actually interested in healing people and treating people in the best way possible. And when you show them, they're like, hey, actually, there's this alternate method. They almost 99% are very interested. And in fact, it's only been some clowns online that say they're doctors and try to have little Facebook fights that haven't been like that. Or people that just are just not even doctors, but they'll just get a bit upset and like, oh man, I can't believe you're saying this sort of thing. But anyone who actually engage and actually like ask questions, basically all of them have been very interested in this, and so everyone knows what I do, and several people in my neurosurgical department have actually started a carnivore diet because of me and had amazing results. Not all of them have stuck to it, some more than others, but some are went strong and have stayed with it. But I don't think it's ethical to withhold what I know from people when I know it can help them. Just like that mother in the middle of the night, we're taking care of her child, and it was just say, by the way, this is something we have 100 years of data on, ketogenic diet, just stop eating carbs, that can help your kids' epilepsy. Wow, really? That's amazing. So I have these conversations when and as they come up, which can be difficult because it's a very, very, very busy. Like neurosurgery is busy even for busy medical specialties, and it takes time to talk to people about this. That was actually one of the reasons I wanted to do a YouTube channel, was just so I could say like, hey, by the way, here's this stuff, get them interested and say, watch these videos. I don't have time to say it all, because I've got 20 other patients that I need to see in the next 2 hours. And it's, but it's something that I feel is very important and can help people. And I've seen it help people. And especially when, people are telling you that they're sick and that they're unwell, and they ask you like, is there something that I can do? I don't think it's possible for me not to tell them, and so I do. And I say it in a very upfront way. I say, hey, look, we don't have large scale human trials on a lot of these things. But this is the information. These are the studies. Here are some resources. Why don't you go look for whatever they have? I mean, something that we have tons of data on, like epilepsy, like diabetes, even Crohn's and ulcerative colitis. There are a number of studies looking at a ketogenic diet and fasting, or called a fasting mimicking diet, but that's just what keto is. and elemental diets, just breaking it down to the macros and micros that you need, and eliminating everything else, and that these have a better efficacy than steroids in treating acute flare-ups. So I mean, this is in the literature, and so I just point this out to people and just saying, like, hey, here are the studies, take a look, see what you think. And so, I think you're pretty safe when you do that. I mean, some people try to dob me in. Like I was telling a patient with Crohn's exactly that. And instead of talking to me about it, some gastroenterology resident just went and tattled on me to his boss. And instead of talking to me, going like, well, what are you talking about? What studies are these? Like an actual doctor and a scientist who's trying to understand his specialty. He just, went to my head of department and was saying, oh, we're going to, report this guy to the medical board. And they were like, well, why don't we just talk to him and just ask him what's going on? I was just like, oh yeah, here it is. It's all evidence-based. Bang, here's all these studies, and, it wasn't an issue, but like, yeah, people get a bit shirty with it, but at the same time, it's all evidence-based medicine. That's what we're meant to practice. And so that's how I see it. And, I don't see that it's ethical to do anything else. So that's how I'm going to play that. We'll see how it goes.
Yeah, fully agree.
Yeah, but yeah, we'll just have to see. I think we are. We just have to change hearts and minds and get this information out there. But I think it is. I meet more and more doctors who are coming to ketogenic or carnivore or PKD way of thinking more and more and more and more, and many of them recently, and I get a lot of people that reach out to me and say that they're a doctor or resident, and they're like, wow, I'm so glad I found this. I feel so great, and I've really started reading all about it. I'm like, I really wish I knew this when I started practicing medicine 30 years ago. This would have been amazing and all this sort of stuff. But at least it's possible now. And so I think the tides are starting to turn. I think we're still very, very early days. I was talking to Dr. Paul Mason over in Sydney, and he's just like, no, we're in a bubble chamber. Like no one knows about this, and indeed we are, because we're looking for it. But I think it's becoming more and more. I think it is becoming more and more popular. I've even had patients. I had
that's a greater awareness.
Yeah.
If I look back to the last 10 years, yes, I can also tell that there is a change in the climate.
Good.
I thought 10 years ago, that we will get farther than this in 10 years' time. I thought we will get much farther than this, than where we are now. But overall, I would put it in the way that doctors are less hostile against us or against anybody who is promoting a low carb.
Yeah.
GPs used to always be quite supportive, I guess, because they have more direct and more permanent relationship with their patients, coming back all the time, knowing their patients better, seeing results. So recently I've had a few patients coming back to me and saying, my GP is okay with this. He acknowledges that he doesn't understand the word, he doesn't understand what ketos is, but seemingly this works. So far, this is working for him. He or she doesn't mind, and he is not too curious or not eager to learn or anything. But for now, that's enough. If he's just not hostile what the patient is doing, he's not going against what he is doing, because that can make a huge difference. Because we, with the patient on both sides, put a lot of effort, a lot of work, and then the patient goes to the GP, and the GP just makes a strange gesture or eyebrow or anything, and the patient is devastated and left in a dilemma. So it is very easy to ruin just because of ignorance what others have done and worked on for months or years. This is what we have seen many, many times, working with the patient for years, stabilizing, everything is improving, good, full life, and then the GP is, or anybody, a specialist is saying something that, oh, I have a concern about your cholesterol.
Always the cholesterol.
Yes, it is always something to point at if you do not like what the patient is doing, the cholesterol. If it is 8 instead of 7, then it is a disaster.
Yeah, and it is surprising to me. I mean, there've been so many big studies about cholesterol that just showing that this was wrong, and not only wrong but fraud.
That's obvious. That's wrong. If they knew the scientific literature for cholesterol is not that meaningful as most doctors think.
Or is meaningful in the opposite direction. A lot of studies.
In other ways, it is meaningful in other ways.
It's good. It's good for you. There have been plenty of studies showing that people with higher LDL cholesterol.
It is carrying information that you need to understand in the context of the whole blood work, but in itself, it doesn't mean anything or something positive rather than negative.
Yeah, exactly. Yeah, and I had someone mention that the other day, that their cardiologist was saying something that they had to stop eating meat, and they had to go like on a plant-based low-fat diet, and it really bothered me. I was just like, well, you can tell your cardiologist that they're 10 years behind the literature in their own field, because like it's literally a decade out of date now by saying that nonsense.
Yes.
And that's a verifiable fact. It's like, I'm not a cardiologist. Why do I know this and you don't? It's not hard. It's to actually look this stuff up, and especially if you're supposed to be staying on top of this. In major publications, the Journal of the American College of Cardiology published in 2020 a massive meta-analysis showing that there was no association between saturated fat and heart disease, and they said there's no upper limit on saturated fat. Just eat whatever, it doesn't matter.
Yes, they already moved the high cholesterol limit from the guidelines, it says. But I don't think that cardiologists are aware of this change. Yes, they are lag behind by a few decades.
Yeah, exactly. So coming back to that, what do you eat? Are you practicing a PKD diet yourself, or sort of?
Yes.
Yeah, oh, that's good.
I do.
Yeah. And how do you feel?
Yes, I feel okay. I feel wonderful.
Good. Yeah.
Yes.
How long have you been doing that yourself?
I'm doing this. I would say it is 2022. It is 9 years that I do PKD.
Very
and
good.
I had 2 good years with a paleo diet, with a popular type of the paleo diet, and before I've been eating everything.
Yeah, well, that's great.
And I'm more and more strict.
Yeah, me too. Yeah, and that's the thing too. It's like it's good to practice what you preach, and if it's so good, like why aren't you doing it? I was like, well,
there is no other way. There is no other way, because if you do not have your own experience, then you cannot really guide patients who are just in the first days, weeks in their diet, they come up with a symptom. What would you tell? How would you tell them what is the right step, or what is the explanation? There are very typical pitfalls that keep being repeated by new patients, like the leg cramp, fatigue, diarrhea. There are a few very typical symptoms, and you're not able to find anything in the literature because there is no such literature. This is just clinical experience that you have gathered across time, across patients. And that's why all my colleagues have to eat in this way. They do not have to, but they eat anyway. because otherwise it is not doable.
Yeah. And what about your family? Has your family been influenced by you at all? Mine is sort of half and half.
That's a tough
Yeah,
question.
it's always tough. Yeah.
That's always tough.
Yeah.
No, unfortunately, they are not following that. And that's kind of painful for me. But I have seen similar family settings with other people too. Yes.
Yeah.
So it for me, it is very difficult to persuade a family member to start following eating in this way. There are a few who or at least know that the way how they should be eating, but not doing, or doing temporarily on and off.
Yeah.
That's already something. But most of them are not following the diet. But I do have a lot of friends. Actually, almost all of my close friends are following this diet.
Yeah. Well, that's good. Yeah. I think family is a bit funny because, they remember you when you were a kid and they were like, well, when you were 7, you had this idea that you were like a fairy princess, and how did that one turn out? So obviously you're wrong now too. And that's, I swear to God, that's how it is sometimes. Yeah.
The thing is that I'm coming from a doctor's family, so everybody in my family
good.
is a doctor. My mother, father, sister, brother, they're all physicians. So it is very, and I'm not a physician. In the first place, I am coming from a biological background, so I'm the only one I'm of the black sheep, and of course I cannot persuade them who are doctors.
Yeah, well,
but that's how it is. They are still family members, they are still relatives, so you just have to live with this.
Yeah, and the funny thing is that, well, A, you're right, and B, you're the one treating patients and actually getting better results than they are, with their traditional treatments, which is, I think you can only ignore that so long before you're in clinical denial, really.
Yes, this should be a cognitive dissonance, I guess, for them.
Yeah. Well, hopefully eventually they come around. I mean, you've been doing this for, a decade now. You've been having amazing results. I would be, surprised if eventually they didn't say like, okay, well, look, let me see your numbers. What are you guys doing exactly? And, let's see what's going on here, because I think that's, the responsibility of any physician. I've seen, anytime you have a patient, I've had a lot of people that I've helped and given advice to, who've gone to their physicians and they reverse their diabetes. HbA1c goes down to 5 from 9 or 10, and all these other markers improve dramatically, and their doctors are still telling them, you got to stop eating meat, it's bad for you. And they're like, have you ever, and when I asked them, it's like, have you ever seen someone reverse diabetes the way I have? They said, no, I haven't. It's like, so why wouldn't you consider for a second that what I did could actually be of benefit? And they just said, you know what, look, I don't have time to talk about this. That's save it for the nutritionist. They just didn't want to hear about it. That's definitely the wrong way to go about things. The right way to go about it is what my mom's doctor did, which is when she reversed her diabetes, she looked at that and said, how the hell did you do this? What the hell did you do? Diabetes is a progressive disease. It only gets worse. We can slow it down, but we can never stop it or reverse it. How the hell did you do this? My mom dropped her HbA1c from 9 down to 6 in 2 months just by eating meat and drinking water, and that's it. And she just told her and just said the kind of things that I was doing, the sort of the research and conclusions that I was coming to. And she was like, I'd really like to talk to him. I'd really like to take a look at his research. And so we went in there and we had a really nice talk for like 2 hours or an hour and a half anyway. And it was like in my mom's consultation, it was supposed to be like 10 minutes, and we ended up just sitting for like an hour and a half. She's just like, this is crazy. And it's right there. She's like, right, makes sense. Let's start making some changes. And so I think, and then she started really looking into it herself and looking at studies and looking at other things. And I sent her tons of studies. Like that's what a doctor's supposed to do. and you're at least supposed to be at least neutral. I had a friend of mine who had 2 carnivore pregnancies. Kids are doing amazing. Their development is literally off the charts. And she tried to tell her OBGYN, who's a great guy. He was actually my professor of obstetrics when I was in medical school. And he's a brilliant man, and very nice guy. And he was very supportive of what she was doing, but he was just like, I'm not too interested in it, but you keep doing what you're doing. And her pediatrician is basically in the same category, but just said, look, whatever you're doing, just keep doing it. And this kid will end up being 6'5" and smart as hell. Like, you don't have to, and so they should at least be supportive in that sense. But it would be nice if they looked at a remarkable outlier and just said, okay, why is this now? How did that happen? I mean, that's why we do case studies in medicine. You say, hey, look at this. This is a special case. Let's study this. Let's take a look at it and see what happened this way.
Yeah, but in reality, there is a massive backslash against case studies where you can present a fully recovered patient. I've been struggling a lot in the last 10 years to publish anything like a full recovery. You may have seen that we have case studies where type 1 diabetics have been put into remission, became insulin-free, and their own insulin production partly returned, which is a big success, because otherwise it is just trending towards zero and remains zero throughout their whole lives. And in such cases, if we intervene early enough, then the own insulin production can be restored. And whenever we did this for the first time back to 2014-15, it was just impossible to publish it, because we got back an email that, okay, you haven't heard about that? Type 1 diabetes is incurable. You cannot cure it because it is incurable. and they just didn't get the point that this is why we are trying to publish this case study. And then somebody else may ask, okay, you are saying strange things. Where is the evidence? Where is your published study?
Right.
And I almost get ashamed that I am not able to publish anything, but this is all my fault. This is the fault of the publication system, and they are ready to publish anything that is related to progression of the disease, treatment without a real result, pseudo results, but not a remission, not a recovery. They're happy to publish this, but they do not want to publish anything that is about a full recovery of incurable disease. So this is how the publication system works, and a breakthrough is impossible, in my opinion. And it's just a lot of effort that you put in publishing, putting together a study, and you go through reviewers and always want to change something like that. And the time just goes away. A lot of patients remain untreated, who may have read this before and saved their life or whatever, but they never get there because this study hasn't been published and will not be published in a foreseeable future. And I have to tell you that the situation is very similar for low-carb journals. It is almost impossible to publish anything like these results in a low-carb journal. Yes, that's the reality. That's the reality.
Weird. Because there's a few studies I saw on fasting mimicking diet, ketogenic diet, doing exactly what you described, reversing type 1 and type 2 diabetes and actually regrowing beta islet cells to the point that it was in animal models, so it was like rats and mice, to the point that they could,
but not humans.
Yeah, exactly.
Not humans yet.
But they would study that, and showed the same thing. They regrowed it and started producing insulin.
So that there are parallels. There are parallels that you can relate to.
Yeah.
But so far it is about an animal model. That's fine, you can publish. But when it comes to a real patient with an unbelievable recovery, then it is a big no.
And that's
we need to find alternative ways to make these results visible.
Yeah, well, I guess we just have to make our own publications, or just, keep getting the word out, and then just, have people just, keep doing this and keep reversing this, and have enough doctors and people take notice. They just say, okay, we really can't ignore this anymore. And whatever sort of biases are in place will just have to be knocked off, or else, their credibility is going to be completely lost, which I think a lot of these things are. I mean, even the New England Journal of Medicine, unfortunately, has been caught up in a few scandals in the last few years of actually, like accepting studies that have been falsified, and changing endpoints, and unblind. So people that don't know, you have a randomized, controlled, double-blinded study. You have people that don't know if they're in the treatment group or the placebo group, and the doctors don't know if they're in the treatment or group or the placebo group. And there have been some studies that were published in the New England Journal of Medicine recently that these people that studied unblinded it, looked at the results, saw who was getting treated, who didn't, just to check the results, found that it wasn't showing what they wanted it to show. And so they started mucking with the data and changing the endpoints, and which is flat out fraud and malpractice. And the New England Journal of Medicine apparently knew this and published this garbage anyway, which is insane, because that's, I think, probably the most reputable publication on earth, at least popularly.
Yes.
And so it's an absolute shame that we see this, and it's it's something that obviously we're going to have to figure a workaround. I think conversations like this, and unfortunately, it's like, oh, I saw it on the internet, is going to become
Yes.
is going to become at least an outlet to get it to circumvent that nonsense.
Mm-hmm.
But the literature is there. The studies are, the data is there. You have, a ton of data, and there are published studies, that corroborate everything we're talking about, in different avenues of, paleoanthropology and biology, and genetics, and biochemistry, botany. All these things, they all corroborate what we're saying, and they all make sense in place together in the whole picture. And so I guess that's the best we can do for now, and hopefully we just keep turning people's minds, and until this becomes too big, until the secret's out, and we just sort of take back over again. Hopefully, that's what I'm hoping anyway.
It will take some time, but let's hope for the best.
That's it.
That this will be happening at some point. At some point, this should be happening.
Mm-hmm.
Because you cannot lie people forever. You cannot push lies or misguided science forever, because it should turn out at some point.
Yeah.
And the way people are searching for their own remedy has changed. So I guess currently there are way many people watching YouTube instead of TV, which is a big, or sticking to social media sources, or following you or any carnivore, and nobody is telling the same thing, but there are commonalities on which they can pick up and find beneficial content there. So yes, the patient choices will make a difference at some point.
Definitely.
Sure.
Great. Well, Dr. Clemens, thank you for fighting the good fight, and I know that you'll keep doing that. And
thank you. I enjoyed the conversation.
Yeah, me too. Thank you so much for coming on. It was an absolute pleasure. I've been an admirer of your work for 4-5 years now, and it was really a pleasure to finally meet you. What's the best way of people finding your work and seeing more of your stuff?
They can follow me on Twitter where I am posting a lot of material, and we do have a webpage which is called nutriintervention.com. They can look up this page for further contents.
Very good. All right. Well, I'll put those links in the show notes, and then people can find you there. So take a look for that, and please do follow Dr. Clemens and follow her work, because I think it's absolutely incredible. She's taking this not just in theory, but she's putting it in practice, and she's actually helping people, which is what this is all about. This is interesting, and it's nice to know about, but it's really important to actually help people with. And so I'm very glad that you're out there doing that. So thank you for that.
Thank you.
You're very welcome.
Bye. Have a nice day.
Thanks.
Bye-bye.
You too.